Hello, everybody. Welcome to BR for You for Them, a monthly podcast where we talk for 5 to 10 minutes about your health. This month, we have Dr. Nancy Mesiha, who is going to talk to us about heart health during pregnancy. Dr. Mesiha has made Michigan her home since 1999 when she came to Detroit area to complete her residency in internal medicine at St. John Hospital and Medical Center. Dr. Mesiha is board certified in cardiovascular disease, adult cardiology, nuclear cardiology, and internal medicine. Along with her private practice, she's program director for Cardiovascular Fellowship Program at Ascension St. John, directs cardiac CT program, and also directs the Women Heart Clinic at St. John Ascension. Dr. Mesiha is a member of American College of Physicians, Michigan State Medical Society, American Society of Echocardiography, and American Society of Nuclear Cardiology. Dr. Mesiha, it's such an honor and privilege to have you today. And also to mention, Dr. Mesiha has authored a chapter in our book, BR She is the Force. So, Dr. Mesiha, we are so excited to have you here today. Thank you for making the time. Please tell us a little bit about during pregnancy, what are the factors that increase the chances of having heart issues? What should our young women who are looking to get pregnant think about?
Thank you, Dr. Sareen, for this opportunity. This is a very important topic. As we know, cardiac disease is prevalent actually during pregnancies. Statistics shows it's anywhere between 1 to 4% of all pregnancies are complicated by cardiovascular disease. As we know, there are certain factors. Some of them are. So age. So as women choose to start their family later on in life after their career, age above 35 becomes an important risk factor. Also, high blood pressure, which kind of goes with age as well. Elevated blood sugars. And this is very much linked to obesity and lack of physical activity. The diagnosis of diabetes prior to pregnancy imposes a risk. Also, alcohol consumption. So everything should be in moderation prior to having a baby or planning to have a baby. Also, some ethnic groups, race, can affect the risk of cardiovascular disease. But however, we say every pregnancy is different, but as far as cardiovascular disease, previous cardiovascular problems during previous pregnancies, mainly hypertension, diabetes, preeclampsia, eclampsia, and cardiomyopathy, definitely affects future risk in future pregnancy.
That is such an outstanding summary, Dr. Mesiha. Thank you. So, lots of factors that have to be kept in mind by our young women when they are planning to get pregnant, especially because death during pregnancy continues to be predominantly due to cardiovascular risk factors. So, Dr. Mesiha, what do you think females should do in their everyday life to have a healthy pregnancy?
So, it's a great question. So, we should all adopt a healthy lifestyle. And this is, as you know, easier said than done. But there are few things that a woman can do so that when she anticipates pregnancy in the future, will decrease risk of cardiovascular disease. So alcohol in moderation, pre-pregnancy, avoid smoking totally, eat a healthy, balanced diet, try to get some exercise, and we hope some exercise most days of the week. So hopefully 5 or more days of the week we exercise. We know stress cannot be avoidable. However, women should have some measures that they can adopt on daily basis, weekly basis, to manage their stress level and really look after their own well-being. Keep your doctor's appointment. This is really important. This is general advice to all women. However, your own doctor will be the one to have a tailored approach so that you become healthy, stay healthy prior to and during your pregnancy.
Thank you, Dr. Mesiha. Some of very important points to know. Eat healthy, exercise regularly, make sure you know your numbers, make sure you know your blood pressure, have healthy lifestyle. If a woman is pregnant, when should they seek medical attention? What are the red flags?
So thank you, Dr. Sareen. This is a really important question. And some of the symptoms of normal pregnancy can really mimic cardiovascular disease and vice versa. So most pregnant women, especially towards the end of pregnancy, will have some shortness of breath. However, if it becomes at rest, if it's interfering with your activities of daily living, if you're short of breath lying down, these are red flags. You really need to talk to your doctor. Most women also during pregnancy will have fast heartbeats. But anything that's above 120 or so beats per minute, especially if you feel it at rest, this is something you need to talk to your doctor about. On the well-being visits and during pregnancy, your doctor is going to measure your blood pressure. So anything above 140 or higher, 90 as a diastolic, should attract some attention. Excessive weight gain, excessive swelling in your legs, especially early on during pregnancy. And women can have heartburns, some chest pain. However, if the chest pain is tight, pressure-like, discomfort, not related to food and not related to position, I think we need to seek medical help.
Thank you, Dr. Mesiha. So listen to your body. And if you have any chest pain, chest pressure, that doesn't happen just with food, then that means there could be something else going on. There are certain heart conditions that happen more in women during pregnancy, and even some forms of heart attack that are more common in women during pregnancy. So such a great review, Dr. Mesiha, of conditions that predispose women, what they should do for healthy lifestyle, and what should they do when they see specific symptoms that can be red flags. Again, you were listening to Dr. Nancy Mesiha. Thank you, Dr. Mesiha, for being here today and sharing this with us and with all our listeners. We will see you back next month for 5 to 10 minutes for another topic. Until then, if you have any suggestions or any requests of specific topics, please email us at beyourselfcontact@gmail.com to look at Dr. Mesiha's chapter on the same specialty. It's available in our book, Bia, She is the Force. Until next month, take care and be safe.